Thank you. I declare open this hearing of the Public Accounts and Estimates Committee. I ask that mobile telephones please be turned to silent. On behalf of the Parliament, the committee is conducting this inquiry into vaping and tobacco controls. I advise that all evidence taken by the committee is protected by parliamentary privilege. However, comments repeated outside of this hearing may not be protected by this privilege. Witnesses will be provided with a proof version of the transcript to check, and verified transcripts, presentations and handouts will be placed on the committee's website. I welcome Associate Professor Becky Freeman from the School of Public Health at the University of Sydney. Ms Freeman, I'm going to invite you to make an opening statement or presentation of no more than 5 minutes, and this will be followed by questions from the committee. Over to you.
Great. Thank you so much for inviting me. I hope I'm familiar to most of you. I think I was one of your first guests when these hearings started off, when I appeared with Simon Chapman. So I'll keep my opening remarks very brief. I just wanted to say that I declare that I have no conflicts of interest with the tobacco industry, that I do not accept any funding or financial, direct or indirect, from anyone who manufactures or sells tobacco products. And I think I was asked here primarily today as a follow-up to answer questions about tobacco licensing. And just to say that tobacco licensing is a key policy priority in terms of controlling the supply of tobacco products. And there are a few, obviously, Australian states that do not yet have a licensing system in place. And I view this as a key priority for tobacco control. And I'm happy to take any questions. Thank you.
Thank you. We're going to go straight to Mr. Galea.
Thank you, Chair. Thank you for joining us again, Associate Professor. You've cited Tasmania as an effective example of tobacco regulation, given that we are, and it's really good to have you back, that we are in this process of looking at a model for Victoria. Can you please talk to me briefly about what are the key features of the Tasmanian model of regulation that make it work, and if it should be used as an example, what lessons we should take from it?
Great, thank you so much. Yes, I think Tasmania has what some people would deem an expensive licensing system. The higher fee, though, I think reflects the fact that it requires enforcement, that it should reflect the cost of enforcing such a policy. So it's not some sort of cash grab. It is be able to fund an effective enforcement program. So that's number one, that it is cost recovery in a real sense. The other is that it's renewed annually. And so this gives an opportunity for retailers to, one, consider whether they should renew or not. It's not one of those things that they forget about for 3 to 5 years, is that it's an annual fee. It gives an opportunity then for, my PhD student did a research project where for all the retailers in an area of Hobart that had their license coming up for renew, a health promotion officer from the Cancer Council went and visited them and asked them, have you thought about maybe not renewing, that there are some things you could sell instead, that, you don't have to sell tobacco products. Would you be open to that? And so it gives an opportunity for intervention as well. And then the other thing that the licensing system does is require quite extensive reporting about where the products are sourced from, how much is sold, and what sort of the offering, the brands, the prices are being sold at. And to me, this is absolutely crucial information in terms of being able to say, okay, so we have these, small retailers in this area, and one is reporting that they're hardly selling any tobacco products at all. But the ones sort of right down the road for them are selling, 10, 11, 12 times the volume. That could be a really easy red flag to say, are they potentially selling counterfeit cigarettes? Are they selling, illicit market cigarettes? And it's also a way of saying we've got these areas where we maybe need to inject more health education resources, better enforcement, because tobacco volume of sales is so much higher in those areas. So those sort of 3 pillars of the Tasmanian system, I think, should make up sort of the base of any licensing system. And then, of course, internationally, you do have all kinds of other requirements you can put on a license, but I imagine you have more questions about that, so I can answer questions about that.
Thank you. Just briefly, the cost factor that you mentioned with the Tasmanian system, what are we talking in? If you're a small business looking to sell cigarettes, what's the difference in what you'd pay in Tasmania in that annual fee compared to whether it's a one-off or other fee in other states?
Sure. So in Tasmania, I haven't checked if it's been indexed for inflation yet, but it's around $1,200 the last time I looked at it, which was quite a bit more than for other states and territories.
Yeah, thank you. And in terms of, you talked about what your PhD students looked at in around the Hobart area, the effectiveness of that sort of renewal process and then causing to stop and reflect, and do we continue to sell this? Firstly, has that been effective? But secondly, has it almost been too effective and driven the market towards illegal operators?
Right. And so this pilot study my PhD student ran where sort of an education intervention with retailers to say, you know what, you don't have to have a tobacco license. You don't have to sell these products. So completely voluntary education based rather than, trying to use sort of a stick method proved to be surprisingly effective. Now, this was just with small retailers, remember. It wasn't with sort of, the big grocery chains or anything like that. And she's had that study published in a really respected BMJ journal, Tobacco Control, and I'm very happy to forward that to the committee after this so you can see what that intervention looked like.
That would be terrific, thank you. I was just going to ask, just to confirm, do the major retailers, the Woolies and Coles of the world, still retail cigarettes in Tasmania?
They do, yes. And in fact, I'm sure you're well aware that our major grocery chains are the sort of the highest volume sales of tobacco products in this country. So unfortunately, it's our fresh food people who are selling tobacco products.
Indeed. There's lots more I'd love to ask about this. I will give up my time just a moment. Just quickly though, are there any other jurisdictions within Australia that have any good lessons that we should be learning, or should all eyes be on Tasmania?
WA also has, I think, a key feature of that particular system that I think is worthy of mentioning is it's a public database as well. So you don't have to, submit a freedom of information request to be able to see that information. It's a publicly accessible database, so you can see where the tobacco retailers are, where they're licensed, which, as a researcher, that's very handy, being able to do tobacco control research, but also for members of the public, it can be like, oh, why does it seem like there's all of a sudden 30 tobacco retailers in my neighborhood? And you can actually look at that data and see if that's true. Having a licensing system, I think, is probably the biggest lesson here. It's unfortunate that our two most populous states, New South Wales and Victoria, do not yet have a licensing system. And if we're going to get a handle on both, managing the illicit market, but also if we're going to use supply side measures, so measures that restrict how readily accessible these products are, we need to have a licensing system in place.
Thank you. And sorry, I will just ask one more question, if I may.
Sure.
When did Tasmania's licensing system get implemented? And are you aware if there were any major challenges that were experienced politically at the time?
I don't know the date. I'm sorry. I can certainly take that under and follow up with you.
Thank you.
I don't want to give something off the top of my head. That's
No worries at all.
Thank you, Mr.
Thank you.
Galea. Mrs. MacArthur.
Thank you, Chair. Thank you, Professor. Tell me, the Tasmanian licensing system, has it had any impact on the illicit cigarette and vaping activities?
right. Well, vaping, we won't know yet. Obviously, the new vaping laws have just been passed. As you know, as of July 1st, vapes can only be sold in pharmacies with a prescription. And then as of October 1st, they'll be behind the counter. So in Tasmania, you could have a license to sell non-nicotine vapes. Obviously, nicotine vapes have never been legal. And so it's one of the few states where we actually have data about how many retailers said they were selling e-cigarettes versus how many that you could just sort of walk down the street and see that they were selling illicit products. And again, my PhD student, she's very productive. She's currently on leave, unfortunately. This is her next study, is that she's analyzing that data to see just how many retailers actually disclosed and had a proper license to sell e-cigarettes. But as we know, most of the e-cigarettes being sold were illicit because they contained nicotine. The illicit tobacco trade in Tasmania is not as significant as it is in Victoria. And so I wouldn't want to be making some sort of judgment about if that's managed the process or not. I think that would be a bit off base for me to say that.
What's your view on pharmacists becoming tobacconists?
Tobacconists? Absolutely not. I would not want to see cigarettes sold in pharmacies. at all.
Oh,
And
well,
cer-
vaping products or
vaping products. Well, vaping products don't contain tobacco. And certainly the vaping products that will be available under or behind the counter, those can be sourced from pharmaceutical companies. They do not need to be sourced from the tobacco industry. And I would find it incredibly ethically and morally distressing if pharmacists decided they wanted to partner with the likes of Philip Morris or British American Tobacco and stock their products when there are viable opportunities or viable alternatives available.
well, that's the proposal of the federal government.
No, it's not. The products that could be sold behind the counter do not have to be sourced from the tobacco industry. They could be sourced from pharmaceutical companies that also manufacture vaping products that will meet the quality standards.
But they don't. They haven't met the Therapeutic Goods Administration standards.
Yeah, you've got. You saw pharmaceutical companies appeared at the Senate hearing. There are absolutely companies who are not tobacco companies who are manufacturing these products and will have them available.
Well, we've just heard from the Pharmacy Guild to say that they don't agree with the proposal of the federal government to become effectively retailers of these products.
Yeah, and I think the Pharmaceutical Society of Australia, who represents the profession, has taken a different view. And I would suggest for any individual pharmacy that doesn't want to stock these products or sell them for whatever reason, is not being forced to.
Is not being sorry?
Is not being forced to. You're not required.
They're not being forced to. Okay, thank you.
Thank you, Mrs. MacArthur. Mr. Tack.
Thank you, Chair. Thank you. In Tasmania, who enforced the licensing scheme?
Yeah, so that's equivalent to the state health department, so the Tasmanian State Health Department.
Okay. So does the local government has any role in that?
The local government? No, this is a state-based licensing system. Obviously, internationally, most of the licensing systems internationally actually are operated by local government level. A lot of the examples coming out of the United States, for example, are local government initiatives. And I know that there is also some sort of differences between states in Australia around sort of some local governments have different smoke-free environments laws, for example. So here in my home state of New South Wales, some local governments don't allow smoking on the sort of outdoor dining or outdoor drinking areas, whereas others do. So there is absolutely scope for local governments to do licensing type arrangements or zoning type arrangements as well that would fit in with their remit.
Thank you, Professor. And has there been any evidence of a reductions in the prevalence of tobacco and vaping product use, associates harm, and the illicit markets in the introduction of the Tasmanian scheme?
Right.
Thank you.
This is a really difficult one because the Tasmanian scheme doesn't have any requirement to reduce the number of retailers. And so because tobacco retailing is so incredibly ubiquitous, and it still is in Tasmania as well, we haven't seen a meaningful enough drop in the number of retailers selling to be able to say, aha, this has impacted on smoking rates. Internationally, you have started to see this have a meaningful difference in terms of the density of retailers because the licensing system doesn't allow, for example, shops that sell tobacco products to be within a certain difference of schools, or doesn't allow another shop to open if the density of shops in that area has already reached a maximum. And so you can get that interim outcome of saying the volume of shops has decreased to a point where it's measurable. And then of course, the long-term impact of that would be decreased smoking rates. But no, I cannot point to a study that has done that yet. In New Zealand, there was a massive push to reduce the number of retailers for the entire country to 600, and that had passed. So that's only 600 retailers. I think I have about 600 retailers in my neighborhood alone. And that had been modeled by researchers that it would have an impact on actual smoking rates. Unfortunately, when the government, the latest election in the New Zealand changed over, that law was repealed and is no longer going ahead. But that was going to be sort of our first real world example of what can happen if you actually meaningfully and dramatically reduce the number of retailers that can sell tobacco products.
Thank you, Professor. Thank you, Chair. Thank you.
Thank you, Mr. Tack. Mr. Puglielli.
Thank you, Chair. Good afternoon. we were speaking before about data and referenced the WA public database in terms of how they're recording all of that information. In your view, what is the best practice approach to ensuring we are capturing data accurately as new laws come into place, the access patterns of vapes across the community perhaps becomes more clear? What's your view?
Yeah, I mean, I'll put my biases on the table right now. I'm a researcher, so to me, data is everything. Without it, it's just stories. And while stories are great, we actually need data to know what's happening. And look, I think data should always be open and transparent, particularly when you're selling such a deadly and addictive drug, essentially, a deadly and addictive product. We should know where it's being sold, who it's being sold to, how much of it is being sold. And I think the nice thing about a licensing system with a fee and reporting requirements is that data can actually be tracked. But there's no point in tracking data if it's not shared or if it's not analyzed or something meaningful is done with it. Data for data's sake isn't it's a waste of everyone's time. So understanding what neighborhoods have a high concentration of retailers, what neighborhoods are selling a lot more tobacco products than others, can help us not only tailor our tobacco control initiatives, but also our enforcement action and make the sort of, the difficult job that enforcement officers have and police officers have, having data to back that up.
Thank you. In terms of interpretation of data, and we've heard a whole lot of different data sets and evidence points.
I'm sure you have.
Over a lengthy period. We've heard from individuals who've claimed that international jurisdictions, I think it was New Zealand was referenced today, where they've sought to regulate their retail vaping market. They've seen a decline, in their words, of young people using vapes over, say, the last 30-day period. But then obviously from your evidence, you've, in your submission concerning Canada, you've stated there's been an increase. Given your sources are from the Canadian context, would you say that, perhaps this is a discrepancy like in terms of the interpretation of data, or what else could it be?
Look, I think there are some interests at play here that try to suggest a really loose approach to vape regulation. For example, allowing flavors, allowing them to be sold alongside other consumer goods like bread, milk, and cheese, that somehow is of massive health benefit. And that if Australia doesn't do that, we're going to miss out on a massive health benefit. And unfortunately, in those countries like New Zealand and Canada, where vapes are a lot more loosely regulated than we have here, you see much higher rates of young people using vapes. And you see much higher rates of young people using vapes on a daily basis. So a clear sign of addiction, right? And if you look at smoking rates between those three countries, so Australia, Canada, and New Zealand, they are all quite similar. But vaping, even in Australia, where we have quite high vaping rates by my research and by the national data for a product that is illicit, the countries like Canada and New Zealand is even higher. And the notion that you require vapes to be readily available in order to get smoking rates low is just not true. And certainly the UK is a really good example that really pushed vapes as a smoking cessation tool, that they should be readily made available to adults, promoted to adults to quit smoking. They've had the same impact on young people as well, with young people increasingly using these products. And to the point where the UK now is also considering legislation to ban disposable vapes. So to make sure that they're not available. Just as we've done here in Australia, disposable vapes will not be part of the over-the-counter model.
Thank you. Thank you, Chair.
Thank you, Mr. Puglielli. Mr. Hilakari.
Thank you, Professor. We've heard a little bit about Tasmania and the tracking of sales earlier. I'm just hoping you could outline some of the key elements of the Tasmanian model, but more importantly, is that the best model? Does somewhere else do it better? And if so, what are their key elements?
Sure. Well, I think there are other places in the world we can look to learn from. In particular, there's a really good example from Philadelphia in the US. And obviously, as I was talking about earlier, this is more of a local level regulation, but Philadelphia is a very big city. And essentially, they're one of the few licensing systems that also introduced, requirements for their retailing system. So essentially, they put restrictions on density and by locations to schools. And then they looked at whether that had an impact on whether there were fewer or more or the same level of stores. They compared this to other cities that were comparable, and tobacco retail licensing strategies had an effect of reducing the availability of tobacco and tobacco marketing. It lessened the economic disparities of tobacco retailer density, because we know that there's more tobacco retailers in lower income neighborhoods. That's true in Tasmania as well. And it decreased the number of tobacco outlets near schools. And what's important about those sort of figures is that we know, obviously, cigarettes being more available in low income neighborhoods drives their use and availability. We know that smoking rates are higher in lower income neighborhoods. And we also know that children who walk to and from school or catch buses to and from school are more likely to purchase tobacco products from those shops. And so not having those shops available helps to limit the access of children to those products. So those are sort of some of the things you can include in a retail licensing system, rather than just having a fee and having, to have someone, having the owner of the store sign the licensing agreement or renew it annually. Those are quite administrative requirements in my view, but then you can have these other requirements that are sort of outcome-based or principle driven. The other sort of requirements that you see for licensing systems are banning things like vending machines, which I understand there are no vending machines in Tasmania, but they're not actually banned as part of the licensing system. That could be something that could be included. You could also have a licensing system that promotes other economic alternatives. So this was in place in San Francisco, for example. So shops that decided that they didn't want to have a tobacco license were eligible for grants and support to stock healthy fruits and vegetables. To me, this seems particularly interesting for maybe rural and remote communities that do have sort of food deserts where fresh food is not as available. It's a way of banning sales that I consider sort of advertising and promotion. And these are well covered in Australia already, like things like having mobile sellers. We don't, for example, allow cigarette girls to go into nightclubs and pubs anymore and walk around selling cigarettes. But in jurisdictions that don't have that, a license could be that sort of thing. Another thing South Australia does, for example, as part of their licensing, is that you are not allowed to do home delivery of cigarettes. So this means that when you're ordering your online groceries, you can't just say, oh yes, and I'll stick a couple of packs of cigarettes on there as well. So home delivery is not permitted as part of the licensing system there. Other things are tobacco retail outlets within a minimum distance of other retail outlets. So that's a density that certain specific retail outlets can't sell. The US has had what I would call a natural experiment in that, and you'll never believe this, but pharmacies aren't banned from selling cigarettes in the US. They're perfectly able to sell cigarettes. But you've had a few pharmacy chains in the US decide independently that they no longer want to sell tobacco products. And this has had, because pharmacies, just like here really, are so ubiquitous and have high density, that's had an impact on the number of retailers who sell tobacco products. So keeping it to certain types of retailers. In France, for example, cigarettes are primarily sold at tobacconists only. They're not sold, in all kinds of different shops. There's obviously pros and cons to that certain approach as well. And capping the amount of tobacco allowed per purchase is something that has been raised. It's not really been implemented anywhere. Reducing the hours or days at which tobacco could be sold. So this is kind of like alcohol licensing, a very similar sort of requirement. And then reducing what types of tobacco products are available. This is in place in Australia at a national level already. For example, we don't permit oral tobacco products into this country to be sold at all, so smokeless tobacco products. And I think there's one more area go ahead.
I might just take you to another area.
Yeah, sure.
I apologise, we're running out of time.
Oh, I understand.
The sales of tobacco in Tasmania prior and post the licensing system coming in, and I'm happy if you take this one on notice.
Yeah.
I'd be interested to understand what the volume being sold was before and after. but also your reflections on what that actually meant. Because, for example, it might be a minimisation or an expansion of the black market, because the sales only reflect those ones that are legitimate sales. So keen to understand that, and happy if you take that one on notice. Just in terms of data, I am also interested and absolutely agree with your view around shared data and useful data are important, really important elements. But have you got examples of where this has been, and again, happy on notice, where this has been effectively deployed for harm minimisation and community health after the fact? So, there is always that risk of collecting data just for, no particular purpose, but really keen to understand those places where it has been deployed, and examples of places where they do it well and where they do it poorly, and what lessons we might be able to learn from that.
Great. Yeah, if I could take those on notice just so I can give you
That would be brilliant.
Evidence
It works for everyone, I think.
Great.
Thank you.
Thank you, Mr. Hilakari. Well, Ms. Freeman, thank you so much for taking the time to appear before the committee again this afternoon. The committee will follow up on any additional questions or questions taken on notice in writing, and responses are required within 5 working days of the committee's request. The committee is going to take a very short break before recommencing this hearing. I declare this hearing adjourned.